Hey, I'm Lex Culbreth. I'm a OBGYN here in Valdosta. I've been practicing with Southern OBGYN for now 27 years. I was born and raised here in Valdosta, went off to school and came back. I think Valdosta is a great place to live. I'm excited about what's going on here at SGMC Health. We are beginning the construction of the Women and Infants Tower. And that will be forthcoming in the next few years. We're excited about that. We're excited about the new service lines that the obstetrics community will be experiencing, namely the level 3 nursery upgrade. Our practice is devoted to high-risk obstetrics, and a lot of those patients will have been shipped out in the past to other larger tertiary care centers. Now we're able to keep a lot of those patients here, so we're excited about it.
Hi, I'm Dr. Elizabeth Flail. I'm the director of the Emergency and Urgent Care service lines for SGMC Health. And I just wanted to take the opportunity to tell you about the growth in the emergency department and urgent care. This past year, we opened up the Smith campus and expanded our urgent care campus to a new site. And in year one, we saw almost 30,000 patients at the urgent care and almost 30,000 patients at the Smith Northview campus. And what just exciting times to be a part of expanding the healthcare system into the Smith Northview campus and urgent care, and just bringing in new patients from the area and giving them the opportunity to be seen more effectively and urgently at these new locations. It's been great to work with the nurses and the medical staff and expand. And really, I was able 5 years ago when Mr. Dean came on to be on the strategic board, and I got to see his vision and his growth and what he wanted to accomplish. And I remember thinking, wow, okay, so he really wants to expand service lines and he wants to grow, especially in the emergency service line. I thought, well, let's see how this goes. You know, I've been here for, born and raised here. My dad was a physician here, and I've been practicing here for 10 years, and I have never seen the growth that we've experienced in all service lines, especially in emergency care, in the past 5 years that we have in 30 years. And that just goes to show that it's leadership from the top bottom that just trickles down, and we all feel motivated. And when you have a bunch of motivated physicians and staff, you can accomplish anything. And so I'm excited and am really excited for 2026 when we have a brand new state-of-the-art emergency department and women and children's, and it's just a great time to be part of SGMC Health.
Hello, I'm Dr. Dallas Miller. I'm the clinical director of our physician network here at SGMC Health. And what an exciting time it is to be a part of SGMC Health System. Over the past 4 years, we have seen an explosive growth in the number of physicians that are employed and our collaboration with our private practitioners in our community. When Mr. Dean first arrived 4 years ago, we only had a handful of employed providers within our network. Mr. Dean brought in a senior leadership staff and did an aggressive needs campaign for our physician needs for our community and our extended region. The success of that culminated in recruitment, and we've had an aggressive, successful recruiting plan that has yielded, we've gone from around a handful of physicians to almost 300 now employed and contracted providers for the SGMC network. What does that mean for our community? It means that we have now become the #1 referral center for higher levels of care here at SGMC Health and our hospital. Simply put, what that means for our community is that you can get all your healthcare needs within our SGMC organization now without having to travel elsewhere.
Hey, my name's Jared Sanders, and I'm one of the general surgeons here at South Georgia Medical Center. I'm excited to be here with you today to discuss what we've got happening in the world of trauma. Less than a year ago, we got our level 3 trauma accreditation, which was a big overtaking, not only by the Department of Surgery as well as our Department of Emergency Medical Services, but also by the community, mainly law enforcement, our EMS services. It was a big buy-in, and it's just been a really good thing. one of the biggest things that we get from this is that increased collaboration and working together. And we also get to set standards and gather information and data which help us to improve upon the care that we're providing to our community. And we've just been able to see mounds of this information coming in. We're still learning what and how to work with it, but it's got everybody at the table talking. Everybody's fired up about it. And it's just been a really good positive thing here, not only for improving the quality that we have for the hospital, the emergency departments, but also for the community, and being able to provide education that leaches out into those communities and counties around us and start working with them as well. So we're very excited for all this. We're happy to see where it leads, and we're ever learning and trying to improve.
I'm Patrick Murray. I'm a cardiac surgeon at SGMC Health, and really excited to be here in Valdosta at this time. With my partners, we're doing some great things in cardiothoracic surgery. We're working on a great way to multidisciplinary approach to atrial fibrillation. There's a fantastic structural heart program here that is growing. We have good young leaders in that area, and minimally invasive valve surgery is a good new big thing we're doing here. We're starting a thoracic robotics program, which is a big deal. To get that going is a nice thing. But really the good thing is we have a lot of senior experienced people, and in a time when there's not a whole lot of experienced cardiac surgeons around, but we've got a great team of them. And we have great leadership in this hospital. We have a fantastic community, and we're doing the latest and greatest things that are really making a difference.